Get out. So you heard
Everybody, please make sure that you're muted as well, please. Hi. So today my talk is going to be about infant feeding follow-up. I'm going to go through kind of a brief history of how infant feeding kind of came to where we are today, the evolution of all of that, as well as then some follow-up kind of questions. We'll go through different feeding methods, and there'll be some time for questions if you have any. So I give this lecture to the residents, or similar lectures to the residents every year, and I've kind of started adding in some of the history just because I find it fascinating that we continue to change what we think about feeding and the best ways to feed a newborn. In classic Greece, there are pictures actually of Hera feeding Hercules. Basically, he decided Zeus, Hercules' father, let him suckle on his wife Hera's milk, and baby then developed the godlike qualities while his wife was asleep. Hera was asleep. He was feeding, and then she woke up, and basically the milk that squirted out came to form the Milky Way, or so Greek history goes. In ancient Egypt, there's even stories that far back that the children of a wet nurse were considered the kin to a king. So we know how important breastfeeding was even in ancient times. Then in the 1700s, women who didn't breastfeed weren't allowed to be on welfare. So that was interesting back then. In the 1800s, they basically went to a wet nurse if a woman was unable to produce milk for her child, or if the mom died during childbirth, as was not uncommon back then. She was basically given a wet nurse. In somewhere around 1845, 1846, the rubber nipple and baby bottle began to be introduced, and those are pictures of some of those on the bottom. Then 1867, they basically developed this formula, which is actually, the term formula came because it is based on mathematical calculations for humanizing cow's milk. So they used cow milk, wheat flour, malt flour, potassium bicarbonate. They started kind of coming up with what was the best formula to most resemble what they thought at the time of breast milk. It began being canned for Civil War soldiers around that time. In the 1890s, they then developed baby formulas that took that canned milk that they were using for the soldiers and created baby formulas. In 1915, a synthetic milk. So this is the first time that non-fat cow milk was used, as well as lactose, oleo oils, vegetable oils began being used. In the 1920s, wet nurses were common for wealthy families. And what happened during that time, basically wealthy families would pay a wet nurse, but she often didn't have enough milk to provide for her own children. So they were sent to these houses that are basically orphanages. So the mom would feed the wealthy's babies while her own were sent to an orphanage. In the 1930s, evaporated milk formulas began being used. We've all seen the Eagle brand milk, and that's when that first started. Commercial formulas, as we kind of know of them today, didn't develop until the 1950s, and then kind of changed for the next couple of decades. The 1980s is when this really took off. The Infant Formula Act came into legislation because of an epidemic of hypochloremic, hypokalemic metabolic alkalosis that was being seen. And so the Infant Formula Act sought to kind of rectify that. And in 1981, the World Health Organization recommended restrictions on marketing infant formula, just so that mothers weren't being discouraged from breastfeeding, and basically said at that point in time, substitutes are okay if they're necessary. In 1986, the minimum concentration was developed, and basically we now have control standards for all those formulas. There's 29 nutrients, control standards, concentrations of everything is now very well regulated. During that time, during the 1986, when they were using all those quality controls, they basically found that back in the 1980 kind of epidemic, that soy formula that was chloride deficient actually is what caused the Bartter-like syndrome, not actually the true milk-based formula that we know of today. So after the 80s kind of laid the groundwork for all of the formula that we see, the 90s didn't really have a whole lot of change. And then the 2000s, they continued to basically add things so that infant formula was as closely mimicked breast milk as possible. So they just basically continued to change the chemical composition. They started doing these systematic evidence-based reviews. They looked at the safety of things. They looked at what was being used, things like that. The FDA then, the most recent legislation was in 2017-18 when the FDA said labels basically have to say exactly what's in it. And the Fair Trade Commission basically said everybody needs to be doing the same thing. So that's why all the brands are essentially the same, except for the labeling, that picture. So it's interesting to me how generationally we change. In the 1930s, nearly all babies were nursed either directly by their mother or by a wet nurse. Then the 70s hit and women's rights and all of that kind of came about, and breastfeeding rates dropped significantly. So they went down to 22%. And then in the 2010s, that number actually reversed. And so it almost flipped. And 79% of babies are now some form of breastfeeding. But what we know is there are so many options. So when a newborn is born, basically mom has lots of choices. Obviously we encourage breastfeeding, but there's lots of ways now to do that. So, you know, back when we started talking about the history of all of this, basically you were nursed at the breast or you had a wet nurse. Now we have bottles, we have breast pumps, we have supplemental nursing systems. We know that babies can take it from a cup or a spoon. There's so many different options. So in the nursery, we kind of help moms lay out at least their initial feeding plan. So I'm gonna put this slide up here. It has lots of scientific kind of information, and I put it up there for human milk, but it'll also be very similar as we go through cow milk-based formula, soy milk-based, all of those other options. The thing I think that is important is that we know we have scientific literature that shows us that babies that are breastfed have reduced risks of ear infections, GI infections, asthma, diabetes, leukemia. The other thing that's important on this slide and what I teach the residents is human milk has a whey to casein ratio of 70-30. That is almost directly flipped in formula. And why that's important is that's the reason why babies stool so often. So the whey passes through their system quicker. So breastfed babies tend to stool, you know, at every diaper change or every feeding, or at least initially. And then formula fed babies, once they kind of normalize, they only stool once or twice a day. So these are basic options. There's, you know, tons of them out there, but these are kind of the brands that we know of for cow milk based formula. 80% of the formula that is sold today in the US is some cow milk based formula. It has a higher concentration of protein and minerals. Cow's milk alone, not the cow's milk formula, has that higher concentration. The cow's milk based formula closely mimics breast milk, and you know, as we saw, they continue to evolve, and the DHA and ARA are added for visual and hearing abilities, as well as some neurodevelopmental things that they saw in studies. So you can tell some of these bottles that it says with DHA and ARA, iron is less bioavailable. So it gets added as well to formula. So we know that they continue to try to do the best they can to make these formulas mimic breastfeeding. It's important to know no actual cow milk for 12 months. And when I tell families that come in for follow-up, I frequently see them in the NICU clinic follow-up. There's nothing that's magical about that 1-year birthday. I mean, so if you're going to run out of formula, a week before, that's okay. If you're going to, have some left over, you don't have to stop like on his first birthday, give him milk with his birthday cake. But generally that 12-month mark is what we tell families they should continue to at least either breastfeed or do that formula for. So here's that slide that I was telling you about for cow milk based formula. If you remember, the protein whey ratio was 70-30 and it's now 18-82. So it's 50% higher total protein content than human milk. And that's the DHA and ARA that I talked about at the bottom. So that kind of tells you how they've come about making cow milk based formula. One of the things that I didn't mention is frequently formulas have taurine added, and that's an amino acid that's high in breast milk, and it's now added to some formulas because studies have shown it helps with brain growth. So as more studies come about, we continue to add things that we know will help these babies. Again, just more information. The vitamin D is something that the residents frequently ask about because most babies that are exclusively breastfed will go home with a prescription or will get a prescription at that first doctor's visit for polyvisol. That's the vitamin D drops. And the reason being is that breastfed babies' mom doesn't have an excess store of vitamin D. So we use lots of makeups and lotions and things that now have SPF in them. So we don't absorb the vitamin D as mothers. And so then we can't pass that on to the babies. So, that's frequently one of the things that's asked is if breastfeeding is best, then why do we need to supplement with a vitamin? It is best in its natural form without us preventing the absorption from the sunlight. It would have plenty. But we do things now so that we don't, as mothers, have as much. So we send them home with vitamin D. Cow milk based formula does have vitamin D in it, but the recommended daily dose for a infant is 400 units, and that is not going to be achieved until they get somewhere between 26 and 32 ounces of formula. And they're not going to take that in the first few days. So my residents that see babies in the nursery typically just send all babies home with a prescription for vitamin D or tell them to get it at their first visit. And then once they kind of reach that volume, they may be able to stop taking it. This slide, as we said before, there's lots of options for how to feed the baby. This is just Similac's version of cow milk based formula. So these are all the options for a baby that is on quote unquote normal formula. So, we think, yes, formula feeding is, easier for the mom or whatever. It might be because you know how much they're getting, as opposed to breastfeeding when you know how long they fed, but not necessarily the volume. But when you go and you stand at the store at Target and look at the shelf, and these are your options for regular formula, there's a lot to consider. So some say for supplementation, I haven't really, there's supposedly studies that Similac has done that says that's better if you're going to use it along with breastfeeding. I don't know that that's true. The sensitive is a little bit more broken down. The organic, Pro Advanced with the HMO. There's all these different options. And I basically tell families, if you're going to go this route, do what's best for you. If you have strong feelings about it being organic, then go organic. We know with the information I gave at the beginning, we know that all these things are well studied, well controlled. So do what you got to do. I even tell them that if you want to use store brand, that's okay too. It is still controlled by the FDA and has very similar ingredients without the label. So Coke versus Pepsi is kind of the way I look at it with them. Soy formulas, that's kind of the next step. And frequently when I'm in the nursery, I'll have families who say their first child was lactose sensitive or may even have a milk protein allergy. Can they do soy? that's fine. There's no reason, there's no good studies that say, you can't do soy from the time they're born all the way until their first birthday. It may not be needed, but if that's what the family wants to do, that's probably okay. The carbohydrate portion is the part that's different. It is lactose free. It uses glucose polymers from corn syrup. So that's the difference there, but otherwise it's basically very similar to that milk-based protein. This is the next step beyond that. And these are so much more expensive that I really encourage families to have conversations with their primary care provider or even a GI specialist before they go this route. So the protein in these is heat treated and enzymatically hydrolyzed. So basically everything is broken down. There's glucose polymers. So there may be times, malabsorptive disorders being one of them, there may be times that that's necessary, but if it's not a medical indication, then it's probably better to find one of the other options. The other thing when I do this lecture with the residents is along the way I get samples of each of these and we actually make them try them. And any of these hydrolyzed amino acid based formulas taste terrible, like truly, truly terrible. But fortunately, infants don't really care. This is a feeding algorithm from Contemporary Pediatrics in 2018 that obviously starts with exclusive breastfeeding, but we know there's lots of reasons why that may not be possible. And then kind of work your way down. Is it a cultural or religious or just family choice to go to soy-based? Transient lactose intolerance, or some other reason. These are a maternal contraindication. Some reason why you need to go down kind of these algorithms. I just thought it was helpful to have in here. There are definitely reasons for supplementation. So in the newborn period, we know that frequently we tell families before they go home to start supplementing, whether it's because of lack of weight gain. So they've lost a certain percentage of weight. They're dehydrated. Their jaundice level is so high. There are medications that mom is on and maybe even on temporarily that cause her to not be able to produce enough breast milk or not breastfeed at all. Multiple gestation, maternal mental health. I always include this because frankly, it is exhausting sometimes to breastfeed. So I always give those moms that option of, if you need to supplement, that's okay. You're not doing the wrong thing. You've got to do what's best for your baby. This medication question is 2 different resources that our lactation consultants use. And basically it tells us whether it's the medication they're on is safe during pregnancy as well as breastfeeding. In general, most things are. There are some medications that we just don't know. But in general, most of them are okay. Again, once we kind of go that route and decide that, yes, we might want to start supplementing, there's lots of different feeding methods for that. A long time ago, you would have said, here's a bottle. If you're going to supplement, you're going to bottle feed. Well, now we have the option of basically baby will drink out of a cup. We can syringe feed. We can syringe feed at the breast. You could syringe feed with a finger. You can do this feeding tube that actually goes next to mom's nipple and supplements while baby is actively nursing. They will take it off of a spoon. So there's lots of options for that as well. So I think it's important to recognize all the different choices that you have when it comes to feeding baby and support whatever family chooses and whatever we need to do that's best for baby. Again, when choosing a bottle, if you go and stand and look at those shelves, there's hundreds of options. There is no literature that says that this bottle is the best, is the most like the natural breast, or that baby is going to have less colic or less. All the bottle companies will tell you theirs does that, but I don't know of any literature and continue to look for it that says this is the right one. What the speech pathologists that we have said that the narrow base actually helps for jaw stability so that they can move the tongue and lips in a coordinated manner. So some of these, even So this is the one that we use in the hospital with the bottle. So you can see it kind of has that narrow base. Some of the others, Tommy Tippies and the Avents, have wider bases. Dr. Brown's, that's the Dr. Brown's nipple. So again, narrow base is maybe better, but that's not what they use and the baby's doing okay with it, don't change it. So once we kind of get them through that initial choice and make their initial feeding plan, and I always tell families in the nursery, it's an initial feeding plan. You're going to follow up with your primary care provider and your plan may change, and that's okay. So don't hang your hat on whatever you go home and we're going to feed and we're going to do it this often and we're going to do it this way. That will change and may change many times throughout that first year of baby's life. But there are normals in what we kind of know to expect. So the AAP says the normal term infant will lose up to 10%. A late preterm infant may lose up to 7 to 8% of their body weight. So once they kind of exceed that point, that's the time that I start to say, okay, now we need to look at some other things, whether it's feeding isn't going well, you think breastfeeding is maybe a problem, or you think that it's time to start supplementing, or, you know, are we burning calories somewhere, any of those things. The type of delivery is also important. So one of the things that my residents, again, frequently forget is that a C-section, mom gets lots of fluids during a C-section, and a prolonged labor, mom also probably got lots of fluids. Well, in turn, baby then gets lots of fluids. So that initial birth weight may actually be artificially elevated just because mom got fluids, baby got fluids, and we have to kind of pee those off the first 24 hours of life. So, you know, if they lose a bunch of weight in that first 24 hours, I don't panic quite yet and kind of wait to see what happens that second day of life. The American Academy of Pediatrics published an article in 2016 that actually looked at the percentage of weight change from day of birth through 4 weeks out and separated it into vaginal births versus cesarean. And so you can see that somewhere around that 3 to 4 day mark, nearly all babies are down below their birth weight. Okay. And then, if they're that top percentile, they may actually start to climb above it before that week of age. But in general, if we look at the 50th percentile, those babies are somewhere around day 8 or 9. They're going to be back at their birth weight. We typically give them till day 14 because, as you can tell, about 90% of them are going to be close to that birth weight by day 14. But remember, the small percentage, there's always those few that struggle behind, may not actually get there until 3 weeks of age. And that's okay. That's just something that probably needs to be monitored regularly so that we can see that upward trajectory. C-section babies, as you can tell, if you look at the curves and kind of, if you were to mirror them or put them on top of each other, you can tell C-section babies typically lose a little bit more weight. And that's just by nature of being a surgery and getting IV fluids during the procedure. So I think that's really important to recognize. Common pitfalls, so things have gone well for the first couple days and they come into the office and things aren't going so well. So underfeeding, how much, how often, that's the very first question that all new families want to know. If you put it in perspective, this is what the baby's stomach size is and how much it will hold based on whether they're a day old, 3 days old, a week or a month out. So if I tell this to families only to say, it may feel like you're only getting drops of breast milk out, but if you know that your baby's belly is the size of a cherry, that's not a lot. So drops are going to be enough to fill that. But what that means is you're going to have to feed more often. So similarly, at a week out, baby's belly is going to hold about 2 ounces, 1.5 to 2 ounces. So I think that's helpful to give them kind of a visual of what that looks like. And again, marble, ping pong ball, or chicken egg, that's kind of stomach size of the baby, as well as what the stool should look like. So that's the other thing that new families always focus on is babies pooping, how often they poop, what it looks like, whether it's black or green or yellow or all the different things. So they want to talk about that too. So that's just kind of a visual of how much things change in that first few days of life. When I tell them leaving the nursery that they should feed 8 to 12 feedings per day, they generally then say, okay, so every 2 to 3 hours? Maybe. That might be every 2 to 3 hours, or it might be every hour for 3 or 4 feedings, and then you may go 4 hours without a feeding. So feed on demand. Watch for those hunger cues. We tell this every single time, licking their lips, sticking their tongue out. Don't wait till they're crying. So I think it's important if we all say the same thing. So when they come for those follow-up visits, if we continue to say the same thing, feed on demand, 8 to 12 feedings a day, I think they'll do better than focusing on the clock. Studies show that somewhere between 2 and 4 months, or once they reach about 12 pounds, they can start to sleep through the night. That's, you know, general. My firstborn didn't sleep through the night till he was 2. So, you know, who knows? But that's what they want to know is, when is the end in sight? At what point can I start to think, okay, it's okay if he's sleeping? Somewhere around 2 to 4 months, 12 pounds is a pretty good estimate. This is a chart that I use in those babies that are graduates from the NICU, because frequently they need higher calorie formula. So this is how to mix it. I'm not going to read all of those things to you. It's there if you want that information. But if you see them and they're just not gaining weight, but you don't necessarily want to increase the volume, there are ways to increase the calories. I think it's helpful if this is actually written out and given to families, as opposed to just told to them, use 3 scoops for 5 ounces of water to get to this 24 kcal. Actually show them, actually do it, because it's not what's going to be printed on all those labels. Overfeeding is super common with formula. It takes far less effort for them, as well as once you mix a bottle, you don't want to waste it. So if you mix a 2-ounce bottle and baby only takes 1 ounce of it, it feels like you're wasting that. But later on, they're just going to have gas and stomach pains and spit it back up anyway. So if they're done, that's okay. There are now studies that show that babies that were overfed had a higher rate of obesity later. So it kind of just sets that metabolism up for obesity. Pacing, this is something I go over with new moms, especially because often they never get past this 1 whole or 0 to 3 month kind of frame when they're supplementing, and that's okay. So the bottles are all labeled with like a time and what age they should be using which nipple. That is kind of true, but formula fed babies that are also breastfeeding, so bottle fed supplemented babies are used to it not necessarily flowing out of 3 holes and coming out quickly. And so they may never get beyond that, and that's okay. If they're leaking or spilling, go down. If it's taking them forever to feed, go up. So just a kind of general rule, faster does not mean better. It takes about 15 to 30 minutes for babies to digest, similar to what it takes us when we have a meal. This is the chart. I'm not really going to go over it because if we're thickening, then there's probably some medical indication. And so those babies are probably followed by a subspecialist or one of our subspecialty clinics. But this is what the definitions mean and how they get to that point. When all else fails, there are so many resources out there. This is the first side over here on the left is the resources that are given out to all moms. And I got that and I thought, wow, that's a lot to look through. But the other side of that is, that means there's a lot of help out there. And I put the second one up because this is our breastfeeding clinic. We have 2 locations, both here in the Kennedy Center as well as out at East. And I will send our families there, even if they're formula fed and have feeding questions. That's okay. So we have lactation consultants who answer all of their questions, go through things, and you may see them for that first visit, you know, at a couple days of life, and then you may not want to see them again until your feeding plans change and you go back to work. And you know, feeding plans change because you started adding cereal, and so you can continue to see them throughout the time. There's lots of help available to how to feed baby best and when to change and what to do differently. What questions do we have? Are there questions in the? Oh, here we go. Okay. Any questions? Anybody have thoughts?
Oh, that's going back.
Okay, let's go down. Oh, we went way back. Hold on.
Someone said, great presentation, great info. Dr. Dizon says, is it okay to give a baby cheese before a year of age?
So as of right now, yes. So, you know, it's kind of like with peanut butter and, you know, peanuts, and the literature right now says, yes, that's okay. Other than honey, which again, that's the unpasteurized and the risk of botulism, but otherwise that's the only food that we limit till after a year of age. The next question was, do you have a guide for formula fed babies? How much should they be getting per weight or per age? So yes and no. I do have a guide, and it's a general guide with lots of ranges. Babies should gain in that first little bit about 30 grams per day. So you can do all the math and kind of calculate that out to how much they weigh and how many calories per ounce, whether it's breast milk, formula, different formulas, higher concentration. In general, I say somewhere around their month of age should be about the number of ounces they take per feeding, but that's a rough estimate. So at a month of age, they should be getting somewhere between 1 to 2. By 2 months, getting around 2 to 3. So kind of a range based on their age.
On speaker.
There was a question. Somebody said, I'm nursing now. Do you have a good way to help me stop? No, but our lactation consultants are happy to see you and help you actually stop as well. So if you need to make an appointment to do that, that is actually perfectly okay. They are welcome those conversations as well. It's different for everybody, similar to breastfeeding and all the different options for that. There's lots of options to stop. It says my daughter's 10 months and has 4 teeth. It hurts. Yeah, been there. I don't have any good advice, but call. I can go back and give you that information.
What do you recommend for the colics on like a 2-month-old?
So a 2-month-old with colic, you can try the gas drops. They may or may not help. The studies that we have show that those work about 50% of the time, which means that 50% of the time they don't do anything. And that could just be parent perception. So, you know, they may not even work that well, but parent thinks they're doing something different. There's not a lot of good information for babies with colic other than to know it's temporary. If you suspect something like a milk protein allergy or something like that, then that would be more medical testing and evaluate the feedings and latch and all of those kinds of things as well.
Any preference between gripe water and simethicone?
No, studies are the same regardless of which one.
Okay, thank you.
Yeah. There was a question about getting access to the slides, and that's fine. I don't care. You can share whatever. So however we want to share those, yes, you can have access to them. Anything else? All right. Well, if you have any questions, I'm here. Email me, whatever. We can get you pointed in the right direction if you have questions about feeding or those follow-up visits. Oh, one more. What are your questions on cashew versus almond versus soy milk? I haven't seen any great studies that discourage one versus the other. I think cost is often the limiting factor for cashew versus soy or almond versus soy. But I haven't seen any good studies that say that one is better than the other if you're not going to do cow milk.
Goins, I have a question to piggyback off that question. Are there any like nutritional differences if a parent chooses to use those non-dairy alternatives?
So nutritional differences, there obviously are some, but again, it's so well regulated that it's probably not enough because you're not using them till a year of age.
Okay.
So at that point, at a year of age, it should not be their primary source of nutrition. So right around that 1 year mark is when they switch to actually getting foods as their source of nutrition and vitamins. So if you kind of keep that in mind, then it's probably okay. Question is, what about goat milk based formula versus over cow milk based formula if accessible? So the American Academy of Pediatrics answer is that goat milk based formula doesn't have the same vitamin component that babies need. So therefore I don't recommend goat milk based formula. I certainly don't recommend true goat milk. There are lots of things on the internet for using goat milk and kind of creating your own quote unquote formula. Obviously those aren't as well regulated. So because we have studies, because we know what's in cow milk based formulas and those things, that's our recommendation from the AAP. Next question is, what are the typical signs and symptoms you see in babies not tolerating regular milk? So typically these babies are going to be overly fussy. Depending on how severe it is, they may actually start refusing to feed. Blood in the stool is one that is very common in true milk-based allergies, but that is frequently microscopic blood in the stool. So that has to be tested in an office. These babies just are generally fussy and typically then they're not going to feed as well and therefore may not gain weight. What else? Any other last minute questions before we have a break, I guess, before the next speaker? Oh, one more. My baby is now 10 months old and grew out of her milk protein allergy. Yes, that's frequently seen. And I've even seen several babies who were diagnosed with a milk protein allergy following some sort of GI illness. And so they have a temporary lactose intolerance. And so that can be reintroduced. Is it okay for me to start feeding her all the food categories? Yes. But again, I would follow the recommendations to only do one new food at a time so that you can monitor for the symptoms of allergies. And you know what it is. Oh. Let me see if I can figure out how to go back up. I went way up this morning. Okay. There was a 20 years ago when I had my children, there was a fridge magnet that had recommendations of when to introduce cereal, fruits, and foods. I followed it fairly strictly. I haven't seen any of these in years. Do you know of any available? So no, I haven't seen those in a long time. I know what you're talking about, but haven't seen those in a long time because basically the studies have shown that there is no need to go in a particular order. You can introduce fruits and vegetables at the same time as cereal. And, you know, as far as textures and things like that, that is a developmental thing. So once they're able to sit up and kind of start feeding themselves is when you can start introducing some of the meltables and things like that. But there at one time was a thought that if you introduced fruits before vegetables, then as they grew up, they wouldn't like vegetables. And they've actually studied that, believe it or not. And those kids ate vegetables. So I tell families, you know, typically we start with cereal just because it's the most easily mixed. So you can mix the cereal with either the formula or breast milk. And when doing that, I recommend making it really thin, remembering that all they've had up to that point is liquid. So make it basically liquid then, and then gradually make it thicker. And then you can start doing the fruits and vegetables. If you want to mix a fruit or a vegetable with the milk, that's okay too. So hope that answered the question. All right, that might be about it.
Thank you so much. Absolutely. Again, if there's other questions, let me know. Thank you, Dr. Goins. We will take another short break until 2 o'clock when our next speaker is scheduled to present.